Hi, and welcome back to Influential Dental, where we are actually interviewing some of the most influential dental professionals in the space. And we're really excited because today we have a very special guest whose show I have also been on, lucky enough. Dr. Len Tau has joined us today, and I'll introduce him in just a second. But I'm joined by my co host, Mike Keeter. And I'm Julianne O'Connor, and we're excited to kick this off. We are at a live event, so I don't know what the sound quality is going to be on this because we have a lot of people walking by and probably some that may want to, serve us some drinks like they did last week. Anyway, so without further ado, Mike, want to introduce yourself and say a couple things and then we'll introduce.
Yeah, sure. Thanks, Julianne. And yes, great to be here at the American Dental Institute event, and want to thank them for being our sponsor. And it is a pleasure to be here with Dr. Len Tau. I've known for quite a few years as well in the dental space, and look forward to talking with him about what he's been up to, his journey, what it means to be influential in this space. And yeah, just have a good time and enjoy yourself today. So again, thanks, Julianne, and look forward to a fun podcast.
So, welcome to the show, Dr. Len Tau with Bird Eye, Mr. Absolutely non-egotistical friend. And, I really appreciate you being on my show. And I appreciate, of course, that, you always share your knowledge. So do you want to kick us off with maybe a little bit more of your background and how you came to this place and where you're at exactly? And then we'll just jump into whatever, candid questions come up.
Sure. Thank you for having me, I should say. It's nice to be at the American Dental Institute meeting in Orlando. And thank you for having me speak in a little bit. So that's why I'm dressed like this. I'm going to change after we're done. So I began my career in 1999 when I graduated Tufts Dental School. Ended up in Southern Jersey at a residency program. Met a woman who became my first wife. Ended up staying in Philadelphia area. Joined a group practice, eventually buying my own practice in 2007. Bought the practice from a dentist, unfortunately, who committed suicide. So it was bought under very extraneous circumstances. But I used that time to learn how to market my practice. I had hired the so-called gurus in the industry that were recommended on Dental Town back then because Facebook really wasn't the place. And the gurus didn't do really well for me, and I struggled to gain really any momentum in my practice. And I said, you know what? I think I'm going to learn to do this myself, and I did. And I tried lots of things. I always say it, threw darts, lots of darts, and a lot of things missed. And I spent a lot of money, wasted a lot of money, but I learned. But a lot of things did hit, and I was asked locally in Philadelphia to speak to a small study club. I still remember the very first time I spoke to this small study club, plugged my Mac computer in there, never doing a presentation before, and it doesn't work. I unplug it, plug it again, it doesn't work. So I presented my very first presentation ever on a laptop in a boardroom, basically, rather than a big screen. After that, it was like I got invited to speak other places, and my speaking career was launched. And I've given over 600 presentations since that time. It was 2010 when I first started speaking.
So
and good.
yeah. So we see you all over in that speaking arena, and I know you have more on that, but I'm just curious, like how do you get everywhere? Because I don't think I have been to a conference that you haven't been at.
Well, it's funny. There's the people always talk about where in the world is Carmen San Diego. Do you remember that show? Now they say where in the world is Len Tau, and so I enjoy traveling. I have one son. My wife is great, so she lets me go when I need to go, and but I enjoy entertaining is really what I do. I mean, I start every one of my seminars with a quote that education without action is just entertainment, and I truly like to entertain. But I also want my attendees to take action, and I have very actionable items when I do speak. But I enjoy going to entertain and speak and be, up in front of an audience. I mean, that's what when you become passionate about something, you want to do more of it, and that's my one. I mean, I have many passions, but my true passion is getting up in front of an audience and wowing them and telling things that they can take back to their office immediately and start to implement. And that's kind of the impetus for kind of how I decide where I want how I want to go about doing things.
So did you miss your calling? Were you really truly an actor, or something, a
No,
musician,
in
anything
fact, I
else?
was never a good public speaker. If you put when I was younger, if you put a camera in front of my face, I will, I couldn't talk. And I still remember in sixth grade, we went to a television studio and we had to do presentations about certain parts of the human body. And I had a presentation I do about the ear. And they put a camera in front of my face and it was horrible. And the teacher basically told me that if I don't get it right this next time, she's going to put the worst one on TV.
Oh, that's
And after she did, and I really had, I don't want to call it stage fright, but I was never a really good speaker. Okay. And I've never taken a speaking class. I just went up on stage and just entertain. I mean, that's what I do. Yes, I have slides I go by and I have a story to tell, but a lot of the stuff I do is more, I don't want to say improvisation, but I kind of feel the room out and decide how I want to do things.
Okay, so is there a defining moment, and I'll give you the mic here in just a sec, but is there a defining moment when you know that you actually overcame the stage fright? Because, this show is all about influential dentists and dental professionals. And we have a lot of people who are asking, how they step into this arena. And, so many people who would like to do what you do. So, and I have more people ask me about the stage fright thing than anything. How do they get the confidence to speak? And sometimes just in front of their own teams. So is there some moment or something that happened that changed that?
The very first time I spoke, which I've already, kind of let you know what happened that first time, there was maybe 20 people there. And they came out to me afterwards and told me that the stuff I spoke about was very motivating to them. But as you being a speaker as well, when people come up to you and tell you that, there's a feeling at the end when you're done that is feeling like no other. And, yes, your patients, being a practicing dentist for, 23 years, when patients come up to you and tell you that you did a good job versus you're on stage and your colleagues and other people come up to you and tell you did a good job, it's a very different feeling. And that feeling I achieved the very first time I spoke. And I remember calling my wife as I was driving home after that first time. I said, I want to do more of this, because it was this overwhelming feeling that you get when that happens. And when I started speaking, people told me that they took action. And you remember when I first got here in Orlando, one of the attendees came up to me and he said, I saw you speak. I think he said 7 years ago or 8 years ago, and it was in Miami. And I remember the event. It was with Arun Garg at Trump International. And he says, I still quote things that you taught me back 7 years ago. We looked it up. It was September of 2017, going on 8 years ago now. And he still uses stuff that he told that to me. And when I hear that, it makes me want to even talk more, because I know I have a lasting impact on people.
Yeah. Well, and it feels good. I mean, it's about doing good or being good and doing good. And that's what you exude. And I think people gravitate towards that, and then it just continues to build. And that's where dentistry is going now. But obviously you're still teaching, you're still coaching, you're still talking a lot of things you did, say 8 years ago or 10 years ago. What do you continually have to reinforce now in today's day? And then what are some things that dentists can still do or can still get better?
So, it's funny. What I continually enforce is that you have to keep doing it. The stuff I teach, you can't just do once, or you can't do it for a year and then stop. The thing is, I teach reputation. I teach the importance of reputation. I teach why reviews help drive more patients to the practice. Unless you're going to not accept more new patients, unless you're, going to close your practice, that's when you want to stop. But otherwise, you need to do these things every single day. You should strive for excellence. You should strive for great feedback from your patients every single day. So the stuff I teach, they should never want to stop, because it helps drive more new patients to the practice. So I think that's a big point. And I hear people saying, well, I don't want to do it any longer, or I don't think I need to do it any longer, or how do I, compare myself to other people? I'm saying, hey, if the dentist down the street has 800 reviews, that's the goal that you need. I have a Facebook group called Raving Patients. I just put a post up, roll call, how many, reviews do you have? Because this is the most I've ever seen for a dental office. And there's a dental office in a town in McDonough, Georgia, very small town. And they have 6,000 plus Google reviews. And because they work on it, but, if you're in that town, your competition has 6,000, you need to strive to get as close to possible as that. Now,
That's when you aim for second place.
yeah, well, you're not right, exactly. You're not gonna get the first place there. But if you're in a small town, and there's a guy who has 100, that's your competition, that's your goal. So you should always strive for it. I don't like to be perfect. I don't think any office has to be perfect, and I want offices to have some bad reviews. I always say that, and when I give every seminars, it's okay. It's not the end of the world if you get a bad review.
Can you
Okay,
explain why that is so people understand?
because it proves that the reviews that you're getting are real, number one, okay? But also, there's no perfect business. If I look online and I see a restaurant that only has 5-star reviews, it's fake as anything, because I know you can't prepare every meal. You can't give great service every time. You're never 100% on your game. Now, I always say, do you have a dental practice? The answer is yes. Do patients leave your practice? The answer is yes. People leave practices for a variety of reasons. You don't take their insurance. You don't offer the procedure they want. So people leave for many times, and if people leave, they're bound to leave a bad review. Okay, so having a bad review is not the end of the world. It's going to be okay. I always like to joke when I give my seminar on bad reviews that, raise your hand if you haven't gotten a bad review yet. And if there's one person in the room, to me, they're not even a real dentist yet, because unless you're a seasoned dentist, you will always have bad reviews. It's just the nature of the game.
And I always say that, like as soon as people kind of hate on you, you've made it, because it can't be real, that unfortunately people are competitive. There's all sorts of things that are happening, and sometimes people are not reasonable, and you just can't even argue with that.
Well, especially in today's day and age, I think with social media and more outlets as well, where you really have to be on top of your game with social media and your reputation. Because one bad review that you don't take care of can ruin a practice or cause so much problems. I would assume that that's true.
Yeah, well, what's the best defense against a bad review? The best defense against a bad review is getting more reviews, to overwhelm it, to overcome it, to make sure it kind of is buried. And I always say that you need 15 reviews to overwhelm one bad review. And again, there's nothing wrong with it. It's going to happen. It's bound to happen at some point that a patient goes online and writes something bad about you. But it's amazing. I don't think I've ever heard in my entire life from any dentist that a bad review has been warranted. They always say to me, well, they've embellished the truth. And my answer to that is, okay, there's 3 sides to a story. There's the patient side, there's your side, and somewhere in between is the truth. So people embellish themselves when they write these stories. And yes, it may not be fair. It may not be, fully truthful, but it's not the end of the world if you get a bad review. Look, I finished my career with well over 2,000 reviews, because it was something I did since 2010 or 2008, 9, whatever it was. And I made it a point for my marketing. I teach reputation marketing, developing your reputation through 5 stars. That's what it is. But I had 91 negative reviews when I retired. 91 negatives is a lot of bad reviews. Okay. But percentage-wise, it's a very small percentage of them. Okay. And people appreciated the fact that my reviews were real. And they didn't complain about my dentistry. I don't think I ever got a bad review about my dentistry. I got a bad review about my New York attitude. I got a bad review about the rules in the office. I wanted my money, okay, because I was a fee-for-service practice. That's what people wrote reviews about, my mouth. I'm direct. Right. I'm a very direct person.
Imagine that you wanted to get paid. I guess everyone wants to get paid for the service they provide. So
sure.
Yeah, if that's the worst of the reviews, like you said, a percentage wise, and you address it head on, then you're fine. And a lot of the speakers at our event are talking about being human, and obviously that's just being human and striving to be your best. I have a non-dental question. I'm sure Joanne can get back to some of the dental ones, but you mentioned you have other passions, and that's what also makes our podcast a little bit different. We want to know the person behind the person, right? And obviously people know you from this interview on what you do with reputation marketing and Google reviews, as well as being an author. But what do you do, or what are some of your other passions outside of dentistry?
So I'm a huge sports fan, huge New York sports fan. So I'm a huge Yankee fan. I went to Game 5 of the World Series this year when they lost to the Dodgers, unfortunately. But I'm a huge sports fan. I love going to live sporting events. So Yankees, Rangers, Knicks, and Giants. I'm sorry to say the Giants suck, but that's just the way it is. So true. Huge sports fan. I love to travel, as you can tell, because I travel a lot. Right. When I was 13 years old, I started the baseball card business. And I sold it when I was 17 years old. and kind of got out of that hobby. I was making $60,000 a year as a 13-year-old. Okay, that's how I got into the entrepreneur space. And yes, I use dentistry as kind of a jump start to other things that I do. But recently, I got back into the sports card industry. And for those that know about sports card, it is a booming industry. And through that, I actually have gotten back full-fledged because I actually partnered with a sports card store locally in Coral Springs, Florida, not far from where I live, and I'm part owner in another business now. So
It's fun. And
yeah,
as a young boy in the 70s and 80s, I was a card collector as well. So it kind of warms my heart to kind of hear that story as an adult later in your career, that you're kind of back there and full circle. So yeah, that is fun and amazing. So that is really cool.
So, I love that you kind of took this in another direction that's a little bit more personal. And, I'm always curious because I think that the listeners are, they see people who are influential, kind of put on this pedestal. And I'm always wondering, what kind of advice we can give them that is from a place of humility and that kind of shares a story. So we could say, hey, we're amazing, but then what have we overcome, like really overcome? Because sometimes I think, hearing like the review thing, don't get me wrong, when I got one bad review, I cried about it, but we've overcome really major things sometimes, and we don't always tell that story. Is there something you can share about some of the obstacles that you've overcome that maybe are a little more vulnerable that you wouldn't normally, come out on your podcast perhaps and say, but you will on ours for some reason?
that put me on the spot. I have to think about obstacles. Well, one, I think, is just the fact that I bought a practice from a dentist who committed suicide, and I overcame the challenges of buying a practice for someone who was very well revered in the Philadelphia area, put my own brand on it, and really had a very successful business for a very long time. So I think that's one. I do want to interject. I don't look at myself as an influencer, though. I really don't. I don't love that word. I look at myself as a key opinion leader, which I think is a better word for me. I'm a content creator. I mean, I'm a networker. People know me because of what I've done, but I don't like to call myself an influencer. I know that and there's nothing wrong with that term. I just don't look at myself that way.
Yes,
I like the
that's
key
the
opinion leadership.
humility play, though, that I'm talking about. So I can say that that's consistent with several of the guests that we've had on the show. Is we know they're influential. That's the reality, and yet they also are so humble about the way that they kind of talk about themselves. Let's talk about just really quickly for a minute, going back to this sort of raw topic about suicide right now, which is
Big topic nowadays.
yeah, this last week, so, this
Couple
week.
people passed away.
Yeah,
Yeah.
it's just, I mean, it's going on and on. I had a colleague that shared stage with me for years and same thing. And so, what would you say that you maybe learned from that, or what would you give in terms of advice to people who are struggling with that? Because you're not somebody, right, who's feeling depressed. You haven't really struggled with it as much, but you've seen it. And so, coming from that place, wherever you've been with that journey, what could you offer to people who maybe are going through something they're challenged by?
One of the things is people who don't realize, but suicide is a very selfish thing. Because they take their own life, but they don't understand the lasting effect that has on everybody else that's involved. And it's funny, when I first got my first, I want to call it real job out of residency, I worked for an office in New Jersey, and I took over for a dentist who committed suicide as well. And then I bought a practice from a dentist who committed suicide. So it happens a lot, unfortunately. But it is a very selfish thing to do, like I said, and the lasting effect on everybody around is pretty traumatic. I would say that there's ways to get help. There's ways to talk about your problems. You just have to let someone know that you're having an issue and not go to that extreme resort that you need to take your life. So I'm certainly not an expert in suicide. There are many speakers that focus on suicide. I just have been affected by it, I would say, in a lot of different ways.
I think it's an interesting take because it's not something anyone has said on the show. Certainly, we had Dr. Kyle Stanley on the show, and he's certainly an expert in that area. But it's an interesting angle I had thought about is just the effect that it has on people, and for people to, not to say that people don't have that consciousness, but you wonder sometimes because we can't ask people after the fact,
Of course.
obviously. But you wonder if people are thinking about that impact, and I would think that they do think about that, but that things are so desperate at a certain place, that
Yeah, you have to be very desperate. It's a
yeah.
desperation attempt to make at the when you decide to take your own life. Um, Regardless, it's far reaching more than they actually think when you take that step in your life.
Yeah, and I think I just want to
Sorry.
add
Yeah,
to
go
this
right ahead.
because you almost, when we approach this topic, right, it becomes almost, seems like a liability, to even have the conversation. But I think the conversation needs to be had because there is help. We know it's preventable. We know that there are things that people can do, and we are hearing recurring themes where people, you kind of mentioned, like, people just need somebody to talk to sometimes. And
Yep,
I think oftentimes people in the dental space carry a huge weight. Would you agree?
I do. I think we look as a dental practice owner of a solo practice. Let's just start with there. You are responsible for almost everything in the office. You're doing the dentistry, you're paying the bills in most cases. You're running the business, you're doing HR, you're doing, all of these things. You are a mini CEO of a practice, or you're the CEO of the practice. You're the pilot. You run everything. And, you could be working 35, 40 hours a week clinically, but then all these other hours afterwards on the administrative side. So look, a small practice is not necessarily going to have a full scale office manager. I did all those tasks until I decided to give them up. But I spent many years working more on my business outside of the practice than clinically in the practice. I only worked 25 clinical hours since I bought my practice. So I wasn't that always working in someone's mouth, but just making sure the business was successful, learning the marketing. These are all things that really play a toll on people.
Well, I think this is a key too, is to learn those and to find out the ones that you're not able to take on fully, to outsource them, whether it's in your own organization or outside the organization. But what you do currently with the Google reviews, and not, if you receive a bad review, it's okay, and to work on striving to do better. I think just acknowledging that with some offices will help them with their mental health, because I guarantee, as Julian said, some may get one or two bad reviews and it's time to close the doors, right? And they don't know how to react to it. So I do think you, and having the ability to cope with those, is helping in this arena with dentists in the dental community.
Yeah, it's really interesting because I remember very, very vividly a woman reached out to me and she said to me she was a brand new dentist. She had her practice maybe a couple of months, and thus she didn't have a lot of reviews. And she got 2 bad reviews in a week. And one of them specifically said that she drilled too deep. That's what the patient said. Okay. And because of that, the tooth was sensitive and was having pain, etc. And she reached out to me and she said, I think I'm going to lose my practice. I'm like, you're not. This isn't the end of the world. You need to, like, literally, I was really concerned with how she was thinking about things. And I said, look, just talk to a couple of your patients, ask them to write a positive review about their experiences. And I guarantee a week later, you'll forget about the bad review and you'll be happy when you receive these positive reviews. And that's exactly what happened. I mean, she got a couple of reviews. She messaged me. She goes, thank you so much for talking me off a ledge. I've had some great feedback from the patients. Yes, it sucks when you get a bad review, but if you get positive reviews, it makes you feel the exact opposite. You feel amazing after that.
Right. And I would go so far as to say, you made me think, what about people who are taken to the board, right? And so you can just go down the rabbit hole with these sorts of situations when you run a business. And if you got sexual harassment suits, sometimes they're not real, sometimes they are. You've got all kinds of things that are happening in the practice arena as a CEO, as you mentioned. And it can be really difficult. What kind of advice can you give to people who are juggling all of that? What was your experience? I mean, you're an entrepreneur now, so it's interesting because you have to be an entrepreneur to run a practice. So what can you, like, some takeaways that they can go implement right now? Any ideas in terms of things that they can do to juggle all of that, or how to look at it so that it's not so overwhelming?
Well, I think as a business owner, I think you have to know what your skills are that you're good at and not good at. So you have to really look yourself in the mirror and say, okay, I'm really good at this particular part of my business. I'm really bad at this, or we're really bad at this. So as a business, okay, we suck at answering phones. Let's just use that one as an example. Okay, we have a very hard time converting patients when we get them in the office. So yes, you're paying for leads. The phones aren't that great answering the phone, so you may struggle to get the people in. But once you get them in, you're bad at converting them as well. That is not a good model. That means you're spending a lot of money on marketing and you're losing them before they, say yes to treatment. So if that's the case, then you need to hire a coach or hire a company to answer the phones, and you need to get better at case acceptance. So again, I think you have to make a list of the things. Hey, I'm great at this. Okay, I'm great at doing dentistry, but I suck at the business side, and get help. Get help. Recognize that you need the help. They always say, and I'm not a drinker. I don't drink anything basically. But if you drink alcohol and in order to get better and you're alcoholic, you have to recognize you're alcoholic or you're never going to get better.
Exactly.
So I think you have to recognize what skills you're good at or what you enjoy doing and focus on that. And look, I am a firm believer, and some people out here that are listening are probably going to go, I don't agree with them, and that's fine because I honestly don't care. But I think that we have to recognize as dentists what procedures we are good at and not good at. I was a great general dentist because I focused on the procedures I enjoyed doing. Okay, I didn't like endo, I referred it out. I hated oral surgery, I referred it out. I love doing dental restoration, implant restorations. I did a lot of it. I love doing clear aligners or Invisalign. I did a lot of that. Okay, I didn't like the things, I wasn't good at the things, I referred them out. So you have to make a list of things you're good at and make that determination.
So when you transitioned away from practicing, right? Did you have any sort of sense that you lost anything, or were you so happy to shift gears and go all in entrepreneurial? Like, what was that dynamic? Because we have a lot of people who are trying to get out of dentistry. Believe it or not, a lot of people don't talk about this, and they are, or they're going through residency, and they are absolutely sure they made a mistake. And and there are doctors that I know who are retiring, and they will not give up their license because they attach their identity to it. So any advice on that?
Well, it's an interesting question you have there. I didn't get through my whole entire story, but basically, I want to go back there for a second because I started my own review software called iSocial Reviews back in 2013. And I remember calling my wife on the phone and said, hey, I think I'm going to create a software program to help dentists get reviews online. And she was like, yeah, have at it. Okay. Little did I know, literally, if you think about it, that was 2012. 12 years later, my entire career would be different. I did not go with the intention of that happening. But I remember as I was starting to gain momentum with things, I met a dentist who was 85 years old and was still practicing dentistry. I said, I'm absolutely not going to be 85 years old and practice dentistry still. So I said, I love dentistry. I loved the whole, everything about being a dentist. Okay. But I liked the other things more. I was passionate about other things and I wanted to go in that direction. So over the years, once I brought an associate in 2017, I dropped down to 2 days a week. And then I was only working 2 days a week until in 2020, I actually moved to Florida, but still owned the practice. And I was commuting up to my office on Mondays and Tuesdays working and then flying back home or flying somewhere else in the country. So I had made the decision in 2020, basically, that at some point in the near future, I would exit dentistry. And when we moved to Florida, that kind of cinched it up. But I worked 2 more years and I stopped in 2022, December 8th. So tomorrow is 2 years.
And this number of hours and seconds.
Yeah, 2 years ago tomorrow, I was my last day. I actually physically worked in someone's mouth, and I wasn't sure because I hear stories all the time from people when they do this that they're gonna miss it. I haven't missed it since the day I left, and I love doing dentistry, but I enjoy doing the other things I'm doing now a lot more.
Total clarity. Then you had total clarity.
100% clarity on that, and I made a decision and it was done, and I really have never looked back at it.
Yeah. And I'll hand this back to you. I swear. He and I fight over the mic, but the reality is, so you maintain so much energy, and I always, wonder what it is that fires somebody up and keeps them energized, where they don't burn out, or do you burn out, and what does that look like?
So I was diagnosed when I got divorced. I went to a person. It wasn't a psychiatrist. I think she's probably a psychologist. And she recognized things about me that I'd never been told before. And she diagnosed me with hypermania.
Interesting.
So what mania, up and down. I don't have a down. I really don't. I'm always up or even up higher. So I'm always on the go. I have some very I don't want to say unique skills, but I remember every interaction I met. I know people that I met 10 years ago. I know where I met them and where, and I talk about those, like I can tell them, hey, I met you here. And they're like, how do you remember that? Because I'm a very big attention to detail.
I think I want that skill set.
One of the most interesting things that I learned, and one of the most influential things on my life, was that when I bought my practice, I hired a coach to help me with the practice. And she came into the office and she was observing me interact with patients and the team. And she pulled me aside and she says, Len, you are a horrible listener. You don't listen to anything anybody says. And I'm going to tell you right now, if you don't fix that, you're going to lose your practice. You're going to lose your patients. You're going to lose your staff. And that hit home. And I said, well, what do I need to do? Because I need you to take a class on what's called active listening. And it will change your life. So I said, sign me up. And that has had a major, profound impact on how I do business now.
So when are you going to start?
Nice.
I'm just messing with you.
So I am an amazing listener. I remember so much detail because I show the person I'm listening to them. And it's something I teach. I'm not an expert. I'm not trained in it, but I at least bring it up when I give my classes because it's a big part of what, really was and that was, remember you asked me like something in my life that is like a turning point and stuff.
Yeah.
That was it. When I became a better listener, I became a better person. I became a better husband, a father, a dentist. I became it literally changed my life. And, I think that's really important to make sure. But I have that skill. So being hypermania, I'm always on the go. I don't really get down. I don't worry about anything. I don't have a worry in life. So
she said I was going to get the mic, but I guess I'm giving
what?
it back now.
It's just so interesting. I'm so intrigued by this because because you're so up, you didn't take that and worry about it at all. You don't worry.
Nope.
So is this interesting to you or not?
No, it's very interesting to me because I am pretty hyper. We're not hyper. I'm not gonna say you're hyper, but I'm up as well. But I do worry about a lot of things as well. So for you to be that way and not have worries is very interesting to me. But I do agree with you on the listening skills, and that's something that I continually work on, and it is fundamental to success, whether it's in the dental office, a dental practitioner, a dental executive, or anyone, right? So that is great advice.
And you've gotten good at it.
Thank you. I'm trying. I'm always trying.
Well, it's funny. There's only one person I don't listen to all the time.
Your wife?
My wife. I have selective hearing with my wife.
Yeah, my wife would probably say the same thing, Len. So we're probably on the same
I
level.
can say it about my husband.
Oh, okay. Well, there we go.
The sound of my voice is like wah 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 all the time.
Well, this has been amazing to talk with you here, and we'd love to have you back on. Are there any other things you'd like to end with? And also, we'd love to share with our listeners and people watching where they can get a hold of you, some things that you have coming up. And again, really appreciate your time and being candid and open with us, Dr. Tau. It's been excellent.
Sure, I'll share with you some information. So I am usually traveling a ton. This year, we're in December now. I have one more speaking gig in a couple weeks, and I'm done for the year. So I'll have completed 36 speaking engagements this year. So I would hope that I tone it down a little bit next year. So we'll see. But I am hosting my own event. My event's in September. It's 2 years ago was in Delray Beach. This year was in Scottsdale. It's back in Florida. In Fort Lauderdale. It's called Supercharge Your Dental Practice. I have 13 amazing speakers. We have about 250 people are going to be attending. So that's at Pier 66 in Fort Lauderdale, Florida, September 26th and 27th. So you can go check it out, superchargeyourdentalpractice.com. If anybody wants to reach out to me, my email is len, L-E-N, at Dr. Len, L-E-N, Tau.com, which is my website, len at drlentau.com. And because it's all over the internet anyway, I don't mind giving it out. My cell phone number is 215-292-2100. I'm the easiest guy to get a hold of. I am uber responsive. If you do send me a message, unless I'm sleeping, which is rare, unless I'm giving a seminar, which is more common, or I don't have Wi-Fi, I usually respond within seconds of getting a message. And you can test me after you watch this.
Oh boy. So I'm impressed right now. And also, it was really fun being on your podcast as well. So can you tell them the name of your podcast so they can follow you there
Yep.
and listen to you?
So my podcast is called The Raving Patients Podcast. Comes out Fridays at 5 a.m. in the morning is when it's released every week. We're entering now. It's going to be season 8. We're completing season 7. It's a weekly podcast episode. So I've done about 350 episodes at this point. I started in 2018, and I had no understanding of how long it was going to last. I was afraid I was going to have trouble getting guests to even come. But we're now 8 years in almost. I won the People's Choice Award with on having one of the best podcasts last year. So it's called Raving Patients, but it really doesn't have to do a lot with the reviews anymore. It's really to focus on practice growth, how to do better in your practice, make more money. And I have about 1,300 downloads per episode, so it's got a pretty good reach. Again, I know that you talk about influence. I mean, I guess there's some influence there.
Hands down. And okay, look, all the humility aside, he's extremely influential. Everybody in this industry has probably been seeing him around, hearing his voice, something. Definitely been touched by you in a lot of different ways. And you have this personality that I think people can love you or they can hate you. Not to be frank, but that's the reality.
It is. That's what it is.
Yeah, and I love to love the people that I could hate. So I just love you, and it's really a blast having you on the show. I really appreciate you being here, and I would love to definitely have you back for another episode at some point. We'll do it remote if we need to.
That's perfect. I do all my podcasts remote, and I don't love it in person because of the noise and stuff.
Yeah,
and I hope that it comes out okay. But no, I appreciate it. I work hard. I'm a hard worker. Everything I've done is because I work hard. Everything I've earned, that type of thing. And I appreciate you having me on and kind of, picking my brain. I've learned over the years that people want to pick my brain because they want free advice. Hopefully I gave some good advice here. So
yeah, absolutely. I'm sure that the listeners will love it. And so if you want to follow American Dental Institute, that's americandentalinstitute.com. And I can be found on social, on Insta at Spelling It, just like it sounds. And without further ado, I'll let you sign us out, Mike.
Yeah, no, thank you. What another great podcast, Dr. Tau. And we're just starting our journey in the podcast realm. So I would love to be doing the same thing 8 years from now as well. So that comment
I
that you
was
just
thinking
made.
the opposite. No, I'm just kidding.
Well, I'm finding to get another partner as well, or do it solo. Just kidding, Julian.
Taking applications right now.
Not at all. But again, thank you very much, and appreciate you, and thanks, Julianne.